Good day. My name is Nur-asia Macabuat, and I'm going to discuss to you MUMPS. MUMPS comes from the British word to mump, that is grimace or grin, because the appearance of a person as a result of parotid gland swelling seems to be in green. So mumps, also known as the epidemic parotitis, is a highly contagious acute viral disease manifested by the swelling of one or both of the parotid glands with occasional involvement of other glandular structures, particularly the testes in males. So itong mumps na usually nagsuswell na yung parotid gland. So yung swelling na it usually peaks in 1 to 3 days and then subsides during the next weekend. Though sometimes na ang nangyayari rin minsan na kapag nag-swell yung parotid gland na magta-travel siya sa other side ng cheek mo hanggang sa post ng mag-swell yung parotid gland mo. So yung swollen tissue na pinupush na yung angle, ear up and out, and as the swelling worsens, the angle of the jawbone below the ear is no longer visible. So before the development of vaccination and the introduction of vaccine, na itong mumps na it was a common childhood disease worldwide. So itong disease na it typically starts with a few days of fever, headache, muscle aches, tiredness, and loss of appetite. So following this, the patient will then suffer from the swelling of the salivary glands, which causes the puffy cheeks and tender swollen jaw. So the hallmark symptoms for this virus is actually the swelling of the salivary glands, and there are actually three sets of salivary glands that we have that is located behind and below our ears. So the first one and the largest one is the parotid gland, and then the submandibular gland, and lastly is the sublingual gland. So these glands are very important to us because they help us produce the saliva, which is important to keep our masks moist, and they also play a role in the digestion of the food we eat. So often, the jawbone cannot be felt because of swelling of the parotid. So one parotid may swell before the other, and in 25% percent of patients, only one side swells. So other salivary glands, which is the submandibular or sublingual under the floor of the mouth, also may swell but do less frequently. Like mga 10% lang siya nag-occur. So this is what mumps look like. So prior to vaccination, mumps was the #1 cause of encephalitis. So the causative agent of mumps is actually from the family of Paramyxoviridae, same with measles. So the genus is Orthorubella and the species is mumps virus. And humans are the only known reservoir for the mumps virus. So itong mumps na it replicates in the upper respiratory tract and is transmitted from person to person through direct contact with saliva or respiratory droplets of a person infected with mumps. Tapos, pwede rin siyang through formats with contamination of saliva and also possibly by urine. So yung risk of spreading the virus increases the longer and the closer the contact a person has with someone who has mumps. So individuals should be considered infectious from 12 to 15 days after exposure, and the only known susceptible host for mumps is human. So the incubation period ranges from 14 to 25 days, and the average is 18 days. So the disease is communicable 6 days before and 9 days after the onset of the parotid gland swelling, and the 48-hour period immediately preceding the onset of swelling is considered the time of highest communicability. Okay, so down to the pathophysiology of this communicable disease, here's the legend, itong nasa gilid. So, as what I have said kanina, itong mumps na it is transmitted through respiratory tract and ang only natural host niya is human beings. So, by that, itong mumps na it is most commonly occurs in children ages 2 to 12 who have not been vaccinated. However, it can occur naman at any age. So, therefore, those unvaccinated individuals and those who have weak immune system, sila yung mas prone dito sa mumps. So once the mumps enters the respiratory tract, the infection begins. Then after being exposed to the virus, it takes 14 to 25 days bago ma-develop yung infection sa katawan natin. Then the primary replication occurs on the nasopharynx and the regional lymph nodes, which can be confirmed with the use of diagnostic tests such as the RT-PCR test and the viral culture. Then once the viremia occurs, which can also be confirmed through the blood test kung meron bang presence of antibodies, then virus is disseminated to target tissues such as the CNS and salivary glands. And then it causes the secondary phase of viremia. Tapos, the virus is then spread throughout the body to kidneys, testes, ovaries, pancreas, and other organs. Then the virus shed in the saliva from 6 days before and 9 days after the onset of the parotid gland swelling. Okay, so the complications. So the most notorious complication of mumps is orchitis, which is testicular involvement usually occurs several days after the onset of the parotid swelling. So orchitis is often accompanied by elevation of temperature, pain is often excruciating, and is aggravated by movement. So the testes are swollen or tender to palpation. So in female naman, we have ophoritis may occur and manifest as pain and tenderness on the abdomen. We also have mastitis. It has also been reported accompanied of mumps. Central nervous system involvement has been reported to complicate mumps as manifested by headache, elevation of cerebrospinal protein concentration, and cell count changes. We also have deafness as a result of mumps has been reviewed and studied. Nuchal rigidity associated with lethargy, headache, convulsions, or delirium. Pancreatitis manifests as epigastric pain, vomiting, chills, and frustration, which can be confirmed through blood test, abdominal CT, and ultrasound. We also have encephalitis, which is, yung sabi ko kanina, the number one cause of mumps before. And it also includes meningitis, in which these two, the encephalitis and meningitis, can be confirmed through the lumbar puncture. Also, rare complications of mumps include transverse myelitis, ataxia, thrombocytopenia, myocarditis, arthritis, and nephritis. So, the yellow boxes are the signs and symptoms like the loss of appetite, muscle ache, fatigue, and parotitis. So, as what I have said kanina, itong disease, it typically starts with a few days of fever, headache, muscle aches, tiredness, and loss of appetite. So, yung muscle aches na it is related doon sa extent ng pagswell ng parotid glands, which is located in front and below the ears. So, sometimes there can also be earache kasi na kapag nag-swell yung parotid gland, napupush yung ear. Yung temperature naman, it usually remains moderately elevated, but it may reach to 40 degrees Celsius during the acute stage of the disease. So in terms of diagnostic procedures, a physical examination confirms the presence of the swollen glands kasi na usually rin na there's no need of laboratory or diagnostic procedures to confirm this. Pero if there is uncertainty about the diagnosis, an RT-PCR test can be done which can detect the presence of viral RNA, which is genetic material of the mumps virus. So ang ginagawa dito is yung buccal swab. And then another one is the antibody test because yun nga, the body forms antibodies in response to infection because mumps immunization triggers antibody formation. So you may have antibodies to mumps virus if you have been immunized. So a blood test can detect the antibodies in your blood and can also help differentiate whether you are immune to the virus or whether you have an active infection. Then yun, if the patient has meningitis or encephalitis due to mumps, the doctor may need to do a lumbar puncture to collect sample of cerebrospinal fluid and then and also the fluid that surrounds the brain. So, nursing diagnosis includes impaired swallowing related to parotitis as evidenced by swelling of the neck secondary to mumps. We also have acute pain and muscle stiffness related to swelling of the parotid glands as evidenced by physical examination secondary to mumps. Okay, so down to the nursing management. So in terms of medical aseptic protective care, clients should be cared for in a single occupancy room. Susceptible individuals must use mask and must wash hands regularly. Terminal disinfection is desirable, and also oral care and overall personal hygiene care is a must. So, in terms of general management of the disease, bed rest is encouraged by some physicians to avoid complications. Diversional activities are recommended for the least ill patients, and then apply a warm or cool compress to your swollen glands to help reduce any pain, and then take over-the-counter painkillers such as ibuprofen or paracetamol to relieve any pain, and then children aged 16 or under should not be given aspirin because of the Reyes syndrome. So, in terms of diet, no restriction of food is necessary except during the acute stage when the patient may find it very difficult and painful to chew and swallow. And then soft and semi-solid foods are easily managed. So, we have to encourage the patient to eat foods that don't require a lot of chewing, such as uh, soup, mashed potatoes, and scrambled eggs. And acidic foods like fruits and juices may increase discomfort because as what I've said, salivary glands yung natatamaan sa virus nito. And this salivary glands produces saliva. So, talagang masakit. And then, we also have to encourage the patient to drink plenty of fluids. So, if your symptoms don't improve after 7 days or suddenly worsens, we have to contact your physician for advice. So down to the medical management. So there is no specific medicine to treat mumps because mumps is caused by a virus. So antibiotics are not effective and symptoms may be relieved the application of intermittent ice or heat to the affected area and by acetaminophen and ibuprofen for pain relief. Because yung treatment for mumps is focused on relieving the symptoms until our body's immune system fights off the infection. So there are currently no medicines to treat the mumps virus because yung infection, it usually passes within a week or two. So if left untreated na itong mumps na, it can be fatal. However, deaths caused by mumps are very rare. Prevention and control, active immunization. So immunization is the only effective method of prevention because mumps can be prevented with MMR vaccine. So this protects against three diseases which are the measles, mumps, and rubella. And CDC recommends children get 2 doses of MMR vaccine starting with the first dose at 12 through 15 months of age and the second dose at 4 through 6 years of age. So the mumps component of the MMR vaccine is about 88% effective when 2 doses are given and 1 dose is about 78% effective. And then reporting of cases to health authority and then isolation of patients. So these are my sources for all of the informations mentioned. And that concludes my report. Thank you for listening.